Hi, I'm Dr. Cynthia Gabaldon. I'm a chiropractic physician and my practice is located in Orlando, Florida. Today we're going to talk about how to alleviate mid-back pain with the use of a foam roller. This exercise is a 6-minute sequence and it helps to lengthen the muscles in the front of the chest to relieve the pressure on the back. Our model Lauren is going to demonstrate our 6-minute sequence. First, you begin with your spine on a foam roller. This is a 6 by 36 inch high density foam roller. The head is supported all the way down to the pelvis. Her knees are bent and allowing her abdomen to not be utilized for balance. Her palms are facing up and they're beginning over by the sides by her hips. The first step is really important. Take a nice, long, deep breath and let the shoulders and arms hang with gravity to allow the pectoralis muscles to be relaxed. Next, notice that the elbows in this position touch the floor. Take the hands and move them up along the floor until the tightness in the pectoralis muscle becomes uncomfortable or the elbows lose their contact with the floor. This indicates that the pectoralis muscle is so tight that it's pulling the shoulder and the arm off of the ground. This is the position we want to start at for 2 minutes. After 2 minutes, turn your face to the right so that your nose is going as far as it can towards the floor. Now, take your head and let it come off of the foam roller towards the floor until you feel the weight of the head pulling on the attachment of the trapezius muscle. This should not cause any pain. It should only feel like a mild stretch. Hold this position for 2 minutes. In the event that numbness and tingling occurs in the arms or hands, that would be an indication that these muscles are so tight that they're actually pressing on the nerves. When patients ask me about this, my typical answer is that this is proof that you really need to do this exercise. After 2 minutes, bring your head back to neutral, turn to the left, and take your head off of the foam roller until you feel the weight of the head tugging on the muscles at the trapezius. Hold this position for 2 minutes. Again, if you feel numbness or tingling, that's just an indication that these muscles are very tight. This should never feel like pain or discomfort. Mid-back pain is a very common topic in my practice. So this is something that I cover with my patients when I'm explaining how to do foam rolling and why. I think it helps to understand how this exercise works to do it. First, we're looking at a spine here. We have the neck, mid-back, low back, sacrum. These curves are very important. The head sits up here. In a typical day, we tend to look down a lot. We look down at our computers, we look down at our iPads, we look at our babies as we're holding them. So we're looking down a lot and our head then becomes supported by the back of the neck muscles. If the back of the neck muscles are holding my head up, they're gonna get tighter than the front of the neck muscles. And if you see this curve, that would make this curve go like this. It's called a military neck, where you lose the curve in the neck. When I do that, I'm actually pulling at the attachments of the trapezius muscle. When I pull the trapezius muscle, when this curve goes this way, if I have the trapezius muscle here, I'm actually pulling it up. So the part that goes between the scapula is where the tightness is most often experienced. Next, if we can pull this muscle out and look at the second layer, these muscles here connect the spine to the scapula. If everything I do is looking down and I'm holding my baby forward or I'm carrying things forward, I'm shortening the shortening the pectoralis muscle and I'm lengthening the space between the spine and the scapula. So the scapula goes away from the spine and I feel this tightness and burning on the inside of the scapula. In order to release that tightness, I need to release the tightness of the pectoralis muscle. This exercise on a foam roller for 2 minutes in neutral, 2 minutes to the left and 2 minutes to the right allows the trapezius muscle to be elongated and allows the pectoralis muscle to be elongated. A good analogy would be doing splits. I can't do splits. If I tried to do a straddle split, maybe I'll get halfway down. If a person comes to my shoulders and pushes me down to the ground, I wouldn't stretch, I would rip. But if I practice doing the splits every single day for a few minutes at a time, it wouldn't take very long for those muscles to lengthen. It takes time and gravity for those muscles to really lengthen. Doing this exercise allows the front of the chest to release the tension and allow the mid-back and the trapezius to regain their normal position. And that's why doing the foam rolling exercises daily, up to 2 to 3 times a day, will help to relieve this chronic pain in the mid-back all the way up the neck to the top of the scapula and the top of the trapezius. This concludes our exercise on foam rolling for mid-back pain.